again to Community Viewpoint. I'm your host, John Pollock. Maria Hurst is next to me. And
hello.
Tonight
Happy Monday.
We have the honor of having Maureen Budahl with us from the Prump office of the Nevada State Health Division. And I have to tell you, this is still Channel 41 for what, 2 more days?
Mm-hmm.
Yes, and then we'll be going to 2046. Yeah, I don't want to give you the wrong station, but we got 2 more days, folks, analog TV. So tonight we're going to be talking, what are we going to do?
Since you said that, I just want to point out that if you have the digital box, you can get all 4 channels of Channel 41, 46.1, 46.2, 46.3, 46.4. We actually play tonight at 6:30 on 46.3, and Monday mornings you see the previous week's show at 10:30 in the morning on regular 46.1.
And where else could you see that forever? On YouTube.
KPVM.TV or YouTube. Just go to Community Viewpoint, KPVM, and just look for our faces, and you can find us and watch us whenever you want.
Okay. And what are we going to be talking about this evening?
We are so lucky to have Maureen Budahl on the show. We've been trying to get her for a long time, and she's going to explain about the Tdap shot, and I'm going to let her tell you what it is, but she's going to explain why it's so important. And so when you hear this in the community, you'll know, and if you know anybody that is around an infant, she's going to explain why it's so important, but you can refer them to this show on YouTube or KPVM.TV, because this is really important information. This is life and death information that can prevent an infant death. So I'm going to hand it over to Maureen. Thank you so much for coming.
Well, thanks for having me. This is a really important topic, and it's really important that we let folks know why the Tdap vaccination is important. Tdap is tetanus, diphtheria, and acellular pertussis vaccine. Now, we all are familiar with whooping cough vaccine. That's what acellular pertussis is whooping cough. And through epidemiology studies looking at people that have been vaccinated and looking at the morbidity information or the occurrence of whooping cough across the United States, but particularly in the western United States, it's come to be known that we no longer have lifelong immunity to whooping cough. So the recommendations have come down that we now require Tdap vaccine for any children entering middle school or 7th grade. Okay. They have to have their first booster. But we also now have this whole cohort of people that were last vaccinated probably when they were 4, 5, 6 before they went to school. John,
yes.
Maria, Maureen. And we thought that we had lifelong immunity, and now we don't, because even in Nye County, over the last 12 months, we've had whooping cough. Up in Round Mountain, we had a little small outbreak of it last year in April. We've had a little corner in Esmeralda County. But we've had a huge outbreak of whooping cough in California. And in California, they've had 10 infant deaths reported from pertussis or whooping cough. Infants, children, small children, cannot be totally vaccinated for whooping cough until they're 12 to 15 months of age.
And that is if the parents are up to date on their shots.
If the parents are up to date and they get their vaccines at 2 months, at 4 months, at 6 months, and then they get that first booster between 12 and 15 months.
Okay, let's say I have whooping cough and you're sitting over there. How would I transmit it to you?
Whooping cough is transmitted by what we call respiratory droplet secretion. So I have a cough, I'm coughing, I'm not containing my secretions, what's coming out of my nose, mouth, whatever, and somebody comes by and breathes it in. Or I cough on the table and someone touches the table and, it's respiratory droplet. So you have to come in contact with the bacteria, because pertussis is a bacteria. You have to come in contact with the bacteria through secretions, through snot, if you will, saliva, that sort of thing, when coughing, what comes up out of your lungs. So because infants cannot be vaccinated until they're 12 to 15 months, if the parents are vaccinating them on time, we have a whole group of infants that are susceptible to whooping cough. So we do what's called cocooning. Okay, and that's my purpose today, is to let folks know out there about this cocooning program. If you are pregnant in the state of Nevada and you deliver in a hospital in Nevada, hospitals are voluntarily choosing to participate in this program, but this program actually provides vaccine for mom and dad at time of infant's birth at no charge to the parents. Okay, so if you protect mom and dad can't get whooping cough, they can't bring it home to the child. And if there are younger children in the home, we worry less about it because, especially if they're in school, they have to be vaccinated to be in school.
So they're protected.
So the risk groups are
adults. Okay.
Any adult that last had their vaccinations prior to entering school when they would have been in kindergarten. So generally, I would say that folks that are in their middle 20s, early 20s, that cohort of folks, all the way on up to senior citizens, honestly, because we also have had whooping cough in elderly people. And of course, the very young and the very old are the ones that are most significantly affected. And our goal is to prevent infant deaths in the state of Nevada. And again, I go back to California. The last time I checked, and it's been several months since I've gotten any data, but they had 10 infant deaths from a totally vaccine preventable illness.
Is this throughout the state of California, or just was it isolated?
No, it was throughout the whole state of California, and of course we're a neighbor to California. Mm-hmm. And we actually have had a pocket of whooping cough in the state of Nevada for several years up in the northeast corner. Elko area, and there's a small community just south of Elko. I've lost the name of the community right now, but we have had active pertussis in the state of Nevada for the last 2 or 3 winters. Okay. So the effort is to vaccinate parents, grandparents, anybody that has close household contact with a newborn should be vaccinated.
And usually, it wouldn't hurt for everyone that knows somebody with a newborn or an infant to do that. It doesn't hurt you. It just helps you. Because a lot of times somebody has a baby, they have a shower after the baby's born. There's all kinds of people. They all want to hold the baby. They just visited a grocery store. Somebody coughed on the cart. You just never know. So it doesn't hurt for people that are going to be around.
The truth is all vaccines should be kept current. It's not just once you go to school, then you're done. Everybody needs a tetanus shot every 10 years. Mm-hmm. If you don't know when your last tetanus shot was, you need to get one. Yeah. We need 1 Tdap in a lifetime after that 7th grade dose. They're still recommending that when you reach adulthood, you have a booster shot.
How many years later? I'm sorry.
Well, the tetanus, was it tetanus and a booster, or is it tetanus? Do they have boosters for tests?
Yes, they do. Well, your primary series was the DTaP that we all know, the tetanus, diphtheria, or the diphtheria, tetanus, whooping cough. When you're 5 years old, you're done with that set. Then when you were 15, you got your first tetanus, diphtheria, just TD, and then every 10 years after that, right? So now that first booster, instead of just being straight tetanus, those kids that are entering 7th grade get the Tdap. They get the tetanus, the diphtheria, and the whooping cough, okay? So kids that are entering college, they're requiring that they have the Tdap. Healthcare providers, I was required to get the Tdap, so I've actually had the Tdap. It's always a good idea to keep your vaccines current, and whether you have an infant in the house or not, if you're not vaccinated, you can get whooping cough, and we know that that immunity wanes. We didn't know that until probably 3, 4, 5 years ago, but so if you don't know when your last tetanus shot was, you need one. If you are one of those people that fit in that group where I talked about, where your last set of shots was perhaps when you started kindergarten, and if you've just had a straight tetanus shot as your boosters over the course of your life, you do need that whooping cough vaccine. So again, the cocooning program, it is available. Almost all of the hospitals in Las Vegas have vaccine available. I'd like to give Dr. Tracy Green credit. She's our state health officer. She's very vested in this program. She wants us to protect our infants. The state of Nevada in general has very low vaccination rates. So that's something that we need to work on, period, which is one of the nice things about having WIC, in public
Yes.
health and clinical services now, because those kids that are behind, we try not to miss an opportunity. They're right there. We have the vaccine. We have the staff to do it. So we're trying to get those kids, up to date as best we can. We have some challenges with vaccines. We have a lot of privately insured kids in Nye County that don't have access to vaccines because we have a great vaccine for children's program, but a lot of our private providers aren't carrying private stock vaccine. So that's something that we're working on. That's something in my office that we're taking a look at. We're not there yet in terms of offering that, but that is something that we're looking at to be able to increase our vaccination rates. So, but having the WIC services in with public health and clinical services, it's no longer your WIC office. We're a one-shop stop. I'm a women's healthcare nurse practitioner, so I provide family planning services, birth control services, cancer screening. We do STD diagnosis and treatment. We do blood pressure screenings, and now we have the WIC services, and that's to make it easier for our clients to be able to get the services like the lead screening and the well child exams, and as well as having the hemoglobins checked through the WIC program. So it's been a good partnership. I know that it's been trying for the WIC clients because you guys have had so many moves, and we have this one more move to look forward to that we're hoping will take place sometime in the middle of the year. I hate to say a date because every time I say a date, somebody changes it on me, but the clinic will be located on the west side of the Calvada Eye, on the property where the other county offices are, and we'll be in with Nye County Health and Human Services and the Veteran Services. So it should be we're looking forward to having more space. I appreciate our WIC clients have been very patient as our community health clients because we are like sardines. Maria.
But it is very valuable to have both the services together because who comes to WIC? Moms and children. Who needs women's health services and vaccinations? Women and children. So it's been really valuable. And actually, if I just kind of want to point out that if you know someone who is pregnant or having a baby, and if they are getting ready to be discharged and the hospital hasn't offered that shot to them, have them tell the hospital, we want this Tdap shot. And because there has been a couple that have come and we've provided that at the...
I always try to give
at the Nevada State Health Division has provided it for them.
We always try to let the pregnant moms know to ask for it. Ask for it. Don't wait for someone to approach you. It's called the cocooning program. Think about a butterfly spins their cocoon and protects what's inside of it. That's the premise behind the program. So all hospitals in the state of Nevada have been offered it. I will tell you that it's a voluntary program. They're not required to participate, but most are. There are some that aren't. Anybody that needs information or wants to talk to one of the nurses about the Tdap vaccine, 751-7070. I'm Maureen. Libby is my nurse that works in the clinic. Either one of us are happy to answer questions. Come by the clinic. We have what's called a VIS, vaccine information sheet, that kind of maps out everything that you need to know about it. It's an important vaccine, especially for those individuals that are having babies. And now, if you're planning a pregnancy, not currently pregnant, but know that you are going to have a pregnancy, get the vaccine prior to the pregnancy, because you cannot receive the vaccine during the pregnancy. As soon as the baby is born, they'll give that to you in the hospital. We also have the vaccine available through Public Health and Clinical Services through our office at 250 North Highway 160 Suite 6. I almost didn't say that. We have a sliding fee scale. Everything we do is based on income. Also, Nye County, through the Community Service Block Grant, the CSBG, Community Service Block Grant, they have also put together a program where folks that, if you are a grandparent, say, and you have no insurance and no access to vaccine, or you have an older child that, let's say you have a 19, 20, 21-year-old that lives in the house with you, or let's say it's just a family friend, because we have so many folks nowadays that have to group together in order to have a home, that it may not even be somebody that's related to you, but you know that you're having this baby, you're bringing this baby home, and these people aren't vaccinated. That's what the Nye County program is for. If you need a medical statement that says you have a need to have the vaccine, I can provide you with that statement. You just would need to come into the clinic, talk to me. If you're connected to a WIC family, it's even easier because WIC, the WIC families are one of our big targets. And again, mom and dad can get the vaccine for nothing through the hospital. But grandparents, even daycare providers, you may not be going to a licensed daycare. You may have a friend of the family watching your infant for you. You need to make sure that that person is vaccinated as well. Because we do have pertussis. Anybody that moves back and forth between California and Nevada at all, you need to be aware that there is a risk. So it's a good vaccine. It's a tried and true vaccine. I mean, we've been given whooping cough vaccine since John was in kindergarten.
So there were really no really bad effects that have popped up.
Generally, soreness in the arm muscle, you get it, is the most significant side effect because you're getting a tetanus shot.
And don't tighten up because it'll hurt worse.
Exactly.
But that doesn't last very long.
No.
It's gone just like a bump.
But we do have resources available. Also, if you have insurance, insurance providers are covering the vaccine as well. And I know that Walgreens had it. They were advertising it. So I know that there are some of the local pharmacies that have the vaccine as well. They will bill your insurance. At this point, we don't have the ability to bill insurances. But if you don't have insurance and don't have resources, that's what the Nye County program is for. So if you need information, that phone number is 751-7095, Nye County Health and Human Services. Or you can call our office and we'd be glad to get you the information for that program.
It's just really important. So however you get it, just get it. And even, I would say, even like we have it at work, we've all received the vaccine, but like you said, daycare providers, people that maybe work in grocery stores and any libraries, any public place.
Anybody that really
comes in contact with anything?
I believe so, but then I'm a community health nurse and we believe in vaccinating. So,
alcohol and drug counselors.
Anybody that has contact with the public has the potential to get pertussis if you're not vaccinated. So, and generally, you can get pertussis any time of the year. In Nye County, we've seen it generally in March, April, that time frame. So it's a good vaccine. Again, the cocooning program with local hospitals, and we are providing that information through our WIC services. So we're going to talk about WIC a little bit now.
You don't have a website, though, do you?
No. Well, the health division has a website.
This information is on there, too?
health.nv.gov, I believe. Yes, it is on there. It's on there as well. Also a good resource if you want information, cdc.gov.
Yes.
CDC?
cdc.gov. Type in Tdap VIS and you'll get a lot of good information. So it's an important vaccine, and it's something that, again, it's a school requirement for any child entering 7th grade.
I mean, it's like you would protect your baby you protect him with a car seat. You put him in a car seat to protect him. You wash your hands to protect them. You
keep them away from
put
sick
coats
people.
on them when they're cold.
Yeah, exactly.
So this is just one of those things, and it's very, very important.
And I think the other thing that we need to really stress is not just newborn babies, but infants that are behind on their vaccination schedule are at risk as well. Tdap vaccine, the whooping cough vaccine, is given at 2 months, 4 months, 6 months. That's what you call the primary series. Once those 3 shots are given, then you wait 6 months and you give that first booster. At that point, they have their best protection. But that doesn't usually occur till 12 to 15 months, 18 months. So if you are a parent of a young child under the age of 12 months of age and you have not finished your primary series, those first 3 sets of shots, your child's at risk. So, and if you've not been vaccinated,
they should get
you're at risk to bringing it home to your child.
And there is a lot of people. I know I travel between here and California all the time, and I know, I probably can name 100 people that I know that do that too. There's a lot of people from here that also are from some part of California, so.
So it's important.
So this push is also on over in Shoshone at the clinic over there too?
I
hope
do.
so.
Oh yeah, because this all started in California. It became the most significant issue in the state of California, and when Dr. Green saw what was happening in California, that's when she put together this initiative to protect Nevada babies,
Right.
because we do have an awful lot of movement. If you think about that western border, think about Tahoe. Reno, Tahoe, Carson City, Gardnerville, that whole area. Then you've got, there's just...
Well, think of I-15 on Friday night coming into Vegas.
Exactly.
There's a good portion of California that comes into Nevada.
That's exactly right. So it's an important vaccine, and I can't state enough how important it is. And there are avenues and resources if you have no health insurance and you're wanting to get this vaccine. We do have some avenues to get that to you.
Great information there, Maureen.
Yes, thank you very much. And
you mentioned once about cleaning your hands like you can go to a store. Is it really worth it to use those little towelettes?
I think so, absolutely.
Yeah.
In fact, I carry a little bottle of hand sanitizer with me all the time. I'll go through, I'm not really a big fan of buffets, but I go through the buffet line and I wash my hands before I eat it. So I got my little hand sanitizer. So yeah, it is
something to think about.
It is something to think about. In the grocery store, they've got a lot of them have the Clorox or the sanded wipes. Grab them, wipe your hands, wipe your stuff down.
Wipe your cart.
You can't be too careful.
Oh, very good.
Okay.
Good words. And you wanted to talk a little bit more
about WIC. About WIC. A lot of people know, but in case you don't, WIC is a supplemental nutrition program for women, infants, and children under the age of 5 or women who are breastfeeding or pregnant. It's a U.S. Department of Agriculture program, and it's to improve the nutrition and birth outcomes of women and children. It's not a welfare program. It's a nutrition program. The main focus is to provide nutrition education to parents. And through WIC, we have services like health screenings, nutrition assessments, and hemoglobin checks, which the Community Health Nurse's Office through the Nevada State Health Division provide. Also, for women who are pregnant and postpartum and breastfeeding, we can check blood pressures. If they're deficient, if there's pregnant women who don't have prenatal vitamins, they're available through either the Medicaid or cash program. But it's also the income guidelines for WIC to get on WIC to receive these services are very, very, very liberal. So,
and in fact, we're just changed to be even more liberal. And our biggest message today is that if you work, and you have small children under the age of 5 and you're pregnant or both, you need to come and see us or call us, because you can make a decent living and still be on the WIC program. Because as Maria said, it is not a welfare program or an entitlement program. It is a nutrition education program. And what WIC participants can purchase under their benefits is very specific to nutrition, and we do nutrition education, and they can see a dietitian or a nutritionist if they're high risk and having problems. And so we want to make sure that folks out there understand that if you are a working person, please consider WIC services if you have children under 5. That goes for single dads, that goes for grandparents raising kids, that goes for aunts and uncles raising young kids, foster parents, anybody that works. I'll just give you an example. If you're a working person and you have a family of 4, a mom, a dad, and 2 kids, okay, you can make $41,348 a year and still qualify for WIC. A family of 2, a dad and a single dad and a child, they can make $27,214 a year. So the guidelines are much more liberal than you might think, And that's because the whole purpose of the program is to better educate our parents so that they're feeding their kids good, and hopefully help with the obesity issues and all those things that we all know are out there. So we want to encourage working people to get in touch. WIC phone number is 727-4884. The community health number is 751-7070. Call us. We're happy to hold your hand through the system and find out if you're able to qualify. We're really working hard on getting working people. We know from the information that we get from the state that we are in need here in Nye County, and we have a program that is very much about feeding children.
And we have it in Pahrump and in Tonopah.
And in Tonopah. Maria's been going up to Tonopah. We increased our services there from 4 hours a month to
2.5 days.
2.5 days a month. So,
and we've tripled our
participation.
So
we're really
cool.
wanting to increase our working people, and we want you folks to know out there that WIC is available, and give us a call. We're glad to get you signed up.
We're in the last half minute. Why don't you two girls do a program on nutrition then?
Okay.
We'll throw that on YouTube.
Okay.
We'll bring the food over
It's
here.
coming. We'll bring one of our classes that we do, and we'll do it on here.
We'll get Kay, the nutritionist from Las Vegas, to do the class.
Okay.
Yeah.
She's
on the hook now. We'll be here too.
Well, thank you for watching and
Thank you.
all the
Thank you so
information.
much.
Maureen.
Thank you for the opportunity. I really appreciate it.
Thank you.
All right, thank you, Jeff. Thank you for
Thank you,
watching.
Jeff.
We'll see you again next week on Channel 46.
Be safe.